Good morning. So today we are going to discuss some common antibiotics that are contraindicated, that is during pregnancy. Some common antibiotics that are contraindicated during pregnancy. So the first class of antibiotics that is contraindicated or that are contraindicated during pregnancy are what we call tetracyclines. So among the tetracyclines, there are two common antibiotics or two common tetracyclines that are contraindicated during pregnancy. So the first tetracycline is called doxycycline, commonly called as Doxil. Okay. The second one is tetracycline itself. So those two common tetracyclines, they are contraindicated in pregnancy. So the main reason why those two common tetracyclines are contraindicated in pregnancy is because, of course, they have that ability of crossing the placenta, but the main reason why we don't give them in pregnancy is because they have that ability of causing dental discoloration due to that enamel hypoplasia that they cause. So they might end up causing dental discoloration in this fetus. So that's the reason why we don't give tetracyclines during pregnancy. The second class of antibiotics that are contraindicated during pregnancy are what we call aminoglycosides. So among the aminoglycosides, there are also two common antibiotics there that are contraindicated. The first one being gentamicin, second one being amikacin. So those two common antibiotics under aminoglycosides, they are contraindicated in pregnancy. The main reason why these two drugs are contraindicated during pregnancy is because they have the ability of causing what is called ototoxicity, meaning they can damage the ears of the fetus and they'll end up causing hearing loss. Okay. The second reason why we don't give these two aminoglycosides, that is during pregnancy, is because they can also cause what is called nephrotoxicity. Nephrotoxicity meaning they can damage the kidneys of the fetus, that is during pregnancy. Okay, so that's it about aminoglycosides. Okay, so that's it about aminoglycosides. So these are the two common aminoglycosides that are contraindicated in pregnancy, mostly here in Zambia. So these are the two common antibiotics that are contraindicated during pregnancy. So the third class of antibiotics that is contraindicated, that is during pregnancy, is what we call quinolones or fluoroquinolones. So among the quinolones or fluoroquinolones, there are two common antibiotics there that are contraindicated, that is during pregnancy. The first one being ciprofloxacin, commonly called as Cyprobid. The other one is what is called levofloxacin. So these two quinolones, they are contraindicated in pregnancy. The main reason why they are contraindicated in pregnancy is because these two antibiotics, they have that ability of causing cartilage damage. Okay, so you find that these babies, when they are born, they will end up being born with joint deformities because their cartilage has been destroyed or damaged, that is during pregnancy. So that's the main reason why we don't give those two common quinolones during pregnancy. The second class of antibiotics that is contraindicated in pregnancy are what we call chloramphenicol. So the drug under chloramphenicol, it's chloramphenicol itself. So the reason why we don't give chloramphenicol, that is during pregnancy, it's because it has that ability of causing what is called the gray baby syndrome. So you find that this baby, when the baby is born, will be having features of cyanosis, poor feeding and all that. So that's the main reason why we don't give chloramphenicol during pregnancy. So the other class of antibiotics that is contraindicated in pregnancy are what we call sulfonamides. So among the sulfonamides, the most common sulfonamide is what is called sulfamethoxazole. So sulfamethoxazole is contraindicated in pregnancy. The main reason why sulfamethoxazole is contraindicated in pregnancy is because it has that ability of increasing bilirubin levels, causing kernicterus. Okay, so that's the main reason we don't give sulfonamides, that is during pregnancy. And this mostly happens in these children that have got P6 GD, okay, P6GD deficiency. That's this is mostly found in those kind of children. So that's the main reason why we don't give sulfonamides, that is during pregnancy. It has that ability of increasing bilirubin levels, putting a fetus at the risk of having kernicterus. Okay, so the other class of antibiotics that are contraindicated in pregnancy are what we call macrolides. So macrolides, they are not fully contraindicated, but you need to use them with caution, that is during pregnancy. The first macrolide is what is called azithromycin, erythromycin, clarithromycin. So those macrolides, you can use them in pregnancy. They are not fully contraindicated, but you need to use them with caution, that is during pregnancy. Okay, you need to use them with caution, that is during pregnancy. So those are the most common antibiotics that are contraindicated in pregnancy. So those are the most common antibiotics that are contraindicated in pregnancy, of which there can be others that can be brought on board, but those are the most common antibiotics that every person who is in health needs to know. Okay, especially here in Zambia, those are the most common antibiotics that are contraindicated during pregnancy. So thank you so much for watching, and kindly subscribe and watch and send this video to as many groups as you can. Thank you for watching. Goodbye.